Hello, everybody. Thanks for coming to our first of our series of support group meetings for 2025. We've selected 6 topics, and this is the kickoff topic where we're going to discuss the overall rationale for metabolic therapy in neurodegenerative disease and aging in general. Just to start, Neurology Solutions has been in Austin since about 2004. We have transitioned to a holistic integrative practice. We've actually always been pretty holistic and integrative, but we decided that we want to focus more now on trying to improve people's metabolic health, knowing that not only helps aging, but it also helps improve symptoms from neurodegenerative disease and reduces the disability from those disorders. We'd like to assist everyone in preventing neurodegenerative disease as much as possible, not just focus on treating patients who already have neurodegenerative disease. So this talk applies to everyone, actually. So just to disclose a few things about myself, I'm currently a consultant for Abbott, deep brain stimulation, product development, and training programs. So we often have representatives from Abbott and also neurologists and neurosurgeons from not only all over the country, but some other parts of the world to come here and learn from us on how we select patients for deep brain stimulation and also how we perform the surgeries and manage those patients after surgeries. From my personal background, my mother passed when she was 86 from Alzheimer's disease, and that had a significant impact on myself and my sister. And that we really didn't understand or have very many tools on how to manage her care once she started to decline, really 8-10 years before she passed. And it's very exciting that in the last 10 or 15 years, more and more evidence is leaning toward how important metabolic health is in not only managing the disease, but preventing it. My father also struggles with vascular Parkinsonism, which is a type of Parkinson's that kind of waxes and wanes, and it's related to changes in the brain that are also quite responsive to metabolic therapies. So I have a personal interest in this. Plus, I'm also interested in aging well and hopefully reducing my risk, family, friends, and everyone's risk of developing these disorders. And I have a career of caring for patients with neurodegenerative disorders like Parkinson's disease. So part of my personal journey was that I decided to adopt a well-formulated ketogenic diet back in 2017. I did that for about 3 years, and I was very excited about the changes that I experienced during that process. But I also came to realize how difficult it was to maintain that lifestyle for as long as I did, and how difficult it was to convince patients to switch their lifestyle toward a ketogenic diet. And I've changed my view on this, that you don't have to completely change your lifestyle to benefit from some of the things that you can do, utilizing some of the things you learn from doing a ketogenic diet, which is something I encourage patients to consider, at least transiently. I also became a stronger believer in intermittent fasting, resistance exercise. I've always worked out since I was 15 years old. And I found that as I've gotten busier with my career and just, life is busy. Sometimes it's hard to keep up with the intensity of exercise. And we'll talk about that at future talks, how important that is for maintaining our physical, mental, and behavioral health and cognitive health as we age. And then I think overall, I'm trying to figure out ways, not just for myself, but for all of us, to regain metabolic flexibility, where our bodies are easily able to adapt to stressors, recover from stressors, and that's going to impact aging and particular disability related to people who already have neurodegenerative disorders. If you think about where we come from, I've always been a big fan of movies like 2001: A Space Odyssey and The Matrix, and trying to understand, what is the universe? Why are we here? And it turns out that we're all a form of energy. Like you probably heard the saying that we come from stars, It's because we do, that we are a manifestation of energy, and that it turns out that aging and human development, as we age, we lose our ability to generate energy in an efficient way. And so by approaching our lifestyle, our diet, avoiding toxic exposures, all of these things can enhance our metabolic energy, and that allows us to compensate for toxic threats, and also when we've already developed neurodegenerative disorder, that we can improve our energy status, and that helps our cells to function more normally, become more youthful, and that translates into better tissue function, organ function, and then better physical, cognitive, and behavioral function. So we know from science in the last 10, 15 years that metabolic dysfunction precedes neurodegenerative disease. This is studies looking at Parkinson's patients. They've done similar studies in Alzheimer's. They call Alzheimer's now type 3 diabetes, where glucose metabolism in the brain is not normal. And we know this is true in Parkinson's too. And it's thought to be even early in the disease, before you have symptoms, that we can see areas of the brain are struggling to function well with glucose metabolism. We also know that when they look at all of the different causes of death, that if they look at the brains, they can see that this tau deposition, these are abnormally folded proteins. Tau is one of them. In Alzheimer's, there's another one called beta amyloid. In Parkinson's, there's another one called alpha-synuclein. These are normal proteins that your body actually manufactures even when you're young. But as you get older, they start to misfold, and your cells don't have a efficient way of getting rid of these abnormal proteins. Whereas when you're young and energy status is normal, the cellular machinery works very well to remove these proteins. And also, just a normally aspirated energetic cell is able to protect these proteins from misfolding. There are chaperone proteins that your body makes that helps to minimize the risk of these proteins misfolding. So by improving our energy status, we are actually increasing our cellular capacity to support normal protein folding and to avoid the misfolding that occurs in age-related diseases like Parkinson's and Alzheimer's. So you can see from this graph, if you are to the left of this line, then the amount of tau protein is increased, and it exists in brain diseases, cancer, and cardiac diseases. So it's not just neurodegenerative disorders. It encompasses several areas of age-related disease. So one of the common things that we know about Parkinson's and Alzheimer's is that insulin resistance and diabetes are associated with these disorders. So if you have significant insulin resistance or prediabetes or actual diabetes, that your risk of developing Alzheimer's and Parkinson's is higher. That said, there are a lot, not necessarily a lot, but a pretty good percentage of Parkinson's patients that don't clearly qualify as having diabetes, or maybe they don't even have obvious insulin resistance. In other words, the glucose is still under control. Quite often we look at some of these patients and they still have insulin resistance. It's just that the pancreas and the ability of the pancreas to produce insulin is still healthy enough to produce enough insulin to keep your blood levels in the normal range. But what's happening in your systemic circulation is often quite different than what's happening in the brain. And if the brain is insulin resistant, as we saw from the earlier slide, that areas of the brain that are hypermetabolic struggle to meet the energy demands just from normal metabolism. And those areas tend to be the areas that are at risk from Alzheimer's and Parkinson's. So hypermetabolic areas include like the basal ganglia, the substantia nigra, the hippocampus. These are more metabolically active areas than other parts of the brain. And they tend to be at higher risk if they're not achieving efficient energy metabolism. So there are other factors that influence this, and that's exposure to environmental toxins. So things like pesticides are linked with causing Parkinson's disease. And as we all know, in the last 40 or 50 years, most of the population has been exposed to a lot of pesticides like Roundup in the food supply. And even though that has been less common, there are other pesticides that are still in the food supply. And so, trying to avoid toxins should be a priority. So what could be the lowest common denominator between these disorders? Inflammation. So there is a vicious cycle that occurs when your body triggers inflammation from whatever cause. The increase in those cytokines associated with inflammation actually make insulin resistance worse. And if we block those cytokines, you can actually make insulin resistance better. So you want to avoid things that cause inflammation. And then once you have inflammation, it actually begets more metabolic dysregulation. And that eventually affects mitochondrial function and the energy metabolism of all your tissues, particularly the hypermetabolic parts of your body, including your brain. So when you have insulin resistance, it impairs your gut health. This diagram on the left side of the screen shows some of the interplay between the lining of the gut and the brain. It's called the gut-brain axis. And if you are exposed to toxins in your diet, it tends to damage the lining of the gut. If there's inflammation related to that, that can create more insulin resistance in the lining of the gut, also elsewhere in the body, particularly in the liver. Insulin resistance begets more inflammation. And then you have breakdown of the endothelial and epithelial lining, not just of the gut, but the lining of your blood vessels, all your tissues. And so as that lining breaks down, especially in the gut, you develop something that's been referred to as leaky gut. So elements that normally stay confined to the lumen of the gut when you're eating food end up breaking through that barrier that's literally one cell layer thick. And when it gets through that barrier, the immune system is educated in the gut. And so you're exposing your immune system to all these antigens that the immune system generally isn't supposed to see. And that creates a lot of immune dysregulation, more inflammation. And then it's this vicious cycle that the inflammation creates more insulin resistance, damage of tissue, lining of the gut, lining of the blood vessels. And then that explains why we see not only neurodegenerative disorders with aging, but also heart attacks, strokes, and even cancer. And maybe in a future talk, I'll get into why cancer is involved with this. So one of the antigens that we see in the gut is called lipopolysaccharide. And we know from the literature that LPS or lipopolysaccharide, when that gets into the bloodstream, affects the immune system, that it induces tau and amyloid in the brain. And this was in a rat model. But and we are a lot different than rats. But I think all of this, if you just add up all the data that we have, it's very compelling that gut health, inflammation, and its impact on aging predisposes us to neurodegenerative disease. Not all neurodegenerative disease. There are some genetic, and there are certainly genetic components to Parkinson's and Alzheimer's. But if we could prevent inflammation, then even those people that are at higher risk for developing these disorders are much less likely to develop them earlier in life and much less likely to have advanced disability from these disorders. And we see that if you look at the blue zones, the people that live to be 100 years old, that eat mainly organic foods, that exercise all the time, that their risk for these disorders is much less. And if they occur, it's much, much later in life. So I do think that there is a lifestyle and nutrition component, things that we can do to reduce the disability and the damage caused that leads to things like Parkinson's and Alzheimer's. So at Neurology Solutions, we try to identify patients and stratify them based on their risk for inflammation. One of the ways we do that is to try to evaluate who has metabolic syndrome. And in this country right now, it's thought to be as much as 80% of the population has some degree of metabolic dysfunction or metabolic syndrome. And the way we look at this is some of the things that occur are just an increase of visceral body fat, and that visceral body fat can surround the organs, fills the liver, and this is a manifestation of insulin resistance. So as we accumulate visceral body fat, that actually accumulation of adipose and triglycerides in fat cells, particularly in the visceral fat, that actually triggers insulin resistance. So it's like the sugar, yeah, it causes insulin resistance, but it's also because when we eat a lot of sugar or simple starchy foods, that gets converted into triglycerides by the liver, and then that gets transported, and a lot of times it's stored in the visceral fat, especially the liver. And so that causes insulin resistance, and that triggers inflammatory pathways that release these cytokines that over time do damage. So how do we define metabolic syndrome? And this was, done by several committees that came together and decided that these were the criteria. It's semantics. So we don't necessarily follow this hard and fast. But if there's any evidence of insulin resistance, either as defined as a fasting glucose greater than 100, which really isn't that high, or a hemoglobin A1C above 5.6, or any sign of insulin resistance. For example, you might have normal blood sugar, normal hemoglobin A1C, but your fasting insulin is 30. It should be closer to 5 or 6. So your pancreas is working very well to produce insulin to keep your blood sugars in what's considered a healthy zone, but your pancreas is working double time trying to produce enough insulin to do that. Eventually, the insulin resistance damages the pancreas sufficiently that blood sugar starts becoming out of control. But a lot of damage has happened before that. So that's why I think it's good to look at metabolic syndrome as an early marker of what's to come if we don't change something. Waist circumference is 37 to 40 inches in men, 32 to 35 inches in women. And this is measured around the navel, without sucking in. And then if your blood pressure is elevated, they changed the criteria 10 or so years ago. It used to be 140 over 90. Now it's 130 over 85. There's still some debate as to whether or not that really results in better outcomes to try to lower people's blood pressure. If it's just borderline, but it's a sign. So if your blood pressure is running high, that usually means there's a certain level of endothelial dysfunction, and that's the cells that line the blood vessels. And if those cells are insulin resistant, their energy status is not very good. They're not able to provide the proper signaling to the tissues around the blood vessels, the smooth muscles. They start becoming harder and less elastic, and then the blood pressure starts going up. And this is sometimes reversible. It certainly is. In my case, I used to have high blood pressure, and I even took medication for it. But with changes in lifestyle, and I'm not perfect by any means, but even that 3 years of being on a ketogenic diet and changing my lifestyle to whatever degree, and I have a lot of patients that have been able to come down on the blood pressure medications just from lifestyle and dietary changes. Including getting the right micronutrients, potassium, and cutting back on sugar, things like that. Another one is triglycerides greater than 150, which that's very common in people who eat a lot of sugar or a lot of starchy foods. The liver is being forced to manufacture a lot of fat for storage from that sugar, and so fatty liver is basically triglycerides being formed and packaged to be stored out in the periphery. And so you want low triglycerides, closer to 50 is optimal. And then HDL, if it's less than 50 in women or less than 40 in men. Now the standard testing that looks at cholesterol, HDL, sometimes in a man it might be 42. Well, if I look at the lipoprotein sizes, quite often we'll find that the HDL is still high risk. And so, we're trying to identify people who are at risk for metabolic disease, and not just be so rigid and strict with these criteria. And then we can also check the urine for any sign of protein leakage. But you only need 3 out of these 5 or 6 criteria to qualify as having metabolic syndrome. And then the importance of sleep. So if you don't get sleep right, then you're actually promoting inflammation, and your risk for metabolic disease is worse. And again, a vicious cycle. So if you have metabolic disease, especially if you're overweight, then that can make it harder to breathe, partly because the structures in the throat have too much fat, the tongue has too much fat, and anatomically you may have just been born with a narrow airway, but when you're overweight, it makes it worse. And then even beyond that, endothelial function is very important. Nitric oxide, the amount you produce in your sinuses. And so inflammation of the tissues in your sinuses, like allergies, all of these are from complex issues that if you address the metabolic syndrome, you address the inflammation, the tissues reduce in the amount of inflammation, you lose weight, you breathe more freely, you produce more local hormones that help to open the airway, like nitric oxide. And so addressing sleep is a very important component toward improving your metabolic health. So I have maybe 5 or 10 minutes left before we move on to the next part of the talk, but I may divide this into 2 talks because it is complicated. But mitochondria are the energy producing organelles in the cells. If you've taken any cellular biology, which is one of the more challenging courses in college, that the cells have these small bacterial-like organelles called mitochondria, and they have these little cristae. They're invaginations, and on these membranes inside the mitochondria, there's an engine. It's called the electron transport chain, and that actually takes your food and converts it into energy that the cells can use, called ATP and NAD. And those are the currencies of energy that your body makes. You make a lot of it when you're young, not so much when you're older. So the number and health of these mitochondria in your cells is directly related to your charge capacity. So if you're a battery and you're young, say you're a D battery, you have a lot of capacity and ability to create current at a given voltage. When you're older, you lose these mitochondria, so your energy capacity goes down. More of these mitochondria are dysfunctional. And so the cells aren't able to produce as much ATP and NAD as they did when you were young. And so the cells are just kind of trying to fight a fight with one arm behind their back. And so what we want to do is find ways to improve the mitochondria, the number and the quality of mitochondria in your cells. And what we can see in this Parkinson's data is, if you look on the left side, in a control subject and a Parkinson's subject, they have relatively the same number of mitochondria. But if you look at the number of healthy mitochondria in the bottom left corner, you can see in the control patients that they have more than double the number of normal mitochondria. So there's something wrong with the mitochondria we have in Parkinson's. They're still there, but they're not very healthy. And then in the graph on the right, you can see electron dense deposits are almost double in the Parkinson's patients, and that's reflective of the alpha-synuclein. That is what causes these electron dense deposits in electron microscopy. And here's a diagram of what that looks like. Normal mitochondria on the left, you can see the healthy, normal-looking membranes in the mitochondria. And then in the Parkinson's patients, they're broken and dysregulated. They're not normal. And so what we want to do is, whatever normal mitochondria we have left, and there are some even in Parkinson's patients, we want those to divide and create new healthy mitochondria. And we want the systems that all cells have in place to get rid of the unhealthy mitochondria to start doing their job. And to do that, that means increasing the energy metabolism and promoting more new healthy mitochondria. And there's a number of ways to do that. Probably the most convenient and desirable way is to change your diet. And in doing so, reach a state of metabolic flexibility, because it turns out that nutritional ketosis, or ketones, actually improve mitochondrial function. And it does that in a number of ways, including stimulating mitophagy and stimulating mitochondrial biogenesis. It also reduces inflammation by lowering TNF-alpha, IL-6. These are inflammatory cytokines. IL-10 is an anti-inflammatory cytokine. So we know from the literature that ketosis does that. But you can't do ketosis all the time. There's a number of ways to create a ketogenic state. One is just fasting, and that's not a bad idea. If you can, find a lifestyle where you're fasting some days of the week, allowing your body to go into ketosis, it will turn on these pathways that repair and get rid of the mitochondria. So you don't have to do it all the time. And just like a bodybuilder, they'll spend time exercising, eating more, growing muscle, and then they'll go through a period where they eat less. They're always trying to eat, healthy, whole foods, but they'll go through a period where they're actually losing weight, including some muscle. So it's a yin and yang. You're trying to build up healthy tissue, and then at other times you're trying to break down and get rid of unhealthy tissue. And so we have to find that perfect combination of lifestyle, exercise, diet, supplementation. All of these things can be work together to achieve that metabolic flexibility that we're looking for. So I'm probably going to save the rest of this for another talk, but I have slides in here from a previous talk that I gave, and just to briefly show you as a teaser, that this shows that if you give MCT oil like C8 or C10, that it actually enhances the energy metabolism in Alzheimer's brains compared to glucose. And so there's data that's building that shows that we can this brain is not dead yet. And it accepts this alternative form of energy, and that it can turn on these pathways. And we see improvements in behavior and cognition. They're using the ketogenic diet to treat autism. They're using it to treat severe depression, a lot of things. So I think finding ways to integrate this into your lifestyle without making it too difficult, because it's just hard to do this all the time, and break it up with times where you're actually exercising to build muscle and increasing your carbohydrate intake to support that. And this also shows that that ketosis improves. Actually, this is data on deep brain stimulation, showing in at least a couple of different studies that it's not just ketones that can stimulate better mitochondrial function. Electrical energy, any type of energy that you actually transmit into the brain, some more effectively than others. Obviously, too much energy like X-rays or microwave radiation, you can damage tissue, but the right type of energy can stimulate mitochondrial biogenesis and better mitochondrial function. And this study showed that. And then there's new evidence showing that electrical stimulation can help macular degeneration. So the macula is like probably the most important part of the retina. It's what gives us our central vision, and it is the brain. And so they've shown by electrically stimulating from the surface the eyes that they are improving the mitochondrial function and the energy metabolism in those parts of the retina that are degenerating. And we actually see reductions in the drusen, which is kind of like if you see sunspots on your skin, that's lipofuscin, these proteins that are accumulating that the cells are not able to get rid of because of their poor energetic status. So we're actually feeding these cells energy, and they're able to come back online and clear out a lot of that garbage, and also stimulate growth factors that promote new cells to grow. And so we're seeing improvements. Like, if you think of a Snellen chart where, you go to the eye doctor and, there's 5 lines and you see how far you can go. And these patients with macular degeneration, they may lose 2 or 3 lines. But with these treatments, they're seeing improvements of 5 to 7. One line is 5 letters usually, and they're seeing some patients are getting 2 full lines of recovery. So this is really relatively new data. So I think that there's a lot. You combine the electrical data from deep brain stimulation and how it stimulates the brain and improves mitochondrial function. And those studies, you've got data from macular degeneration showing that electrical stimulation improves the neurons in the retina. And there's even evidence now that red light therapy is just another form of energy, that you're stimulating cytochrome. I think it's called cytochrome oxidase, which is a important enzyme in the electron transport chain. If you're stimulating that with red light, then the mitochondria come back online. They become healthier. They start to operate more efficiently. And this also showed benefit in people with macular degeneration. So I think there's lots of reason to think if we can improve our energetic status of our overall metabolism, our cellular energy, our mitochondrial function, that we're going to have better aging and better long-term outcomes, whether or not you have a neurodegenerative disease, but particularly if you do have one. And so that's one of the major points of the practice now, is to try to maximize that for everybody that's interested. Of course, this is hard to do, so we want to help, guide that. And it's just I understand some of this isn't practical, but we certainly want to encourage it. So that's it for the talk. And thanks everybody for showing up. All right, thanks.